In this video, let's discuss why you should read Repetitive Strain Injury, A Computer User's Guide by Emil Pascarelli, MD, and Deborah Quilter. This book is mostly for computer users who experience symptoms of RSI. The first reason why you should read this book is to assess your risk of RSI. Warning signs like constant fatigue, pain, weakness, tingling, numbness, or sudden clumsiness could indicate an impending injury. You may be prone to RSI if you use a computer or mobile device daily, don't take frequent breaks, are loose jointed, use poor posture or poor technique, work in a high pressure environment, don't exercise regularly, smoke tobacco, drink alcohol in excess, or are overweight. The second reason is to find the right doctor who can diagnose you accurately and prescribe good treatment. For a lot of people, choosing the right doctor may be a leap of faith. Evaluate your physician according to specific criteria outlined by the authors. Hopefully you can find a doctor that meets all of these, but you might not. You might need to take a leap of faith. The third reason for you to read this book is to learn about common diagnoses of RSI injuries. Compare the author's descriptions of RSI conditions to your own symptoms and ask your doctor about the ones that sound like yours. Muscle and tendon disorders, nerve disorders, or a variety of associated disorders could be the condition behind your symptoms. Remember that you cannot diagnose yourself. The fourth reason is to protect your vision from repetitive strain. These days, the condition is more commonly called computer vision strain, CVS, or eye strain. Long, uninterrupted hours staring at a screen can fatigue the ocular muscles. Rest your eyes during breaks. Get outside and look at faraway things every day. Keep your screen clean to allow your eyes to focus better. The fifth reason is to discover treatment options, including self-treatment for RSI. Firstly, you need to be an active and engaged participant in your RSI recovery journey. Be an informed medical services consumer by paying close attention to the doctor's instructions, asking questions, and advocating for yourself. The book details the benefits and differences between occupational therapy and physical therapy. Pay attention to your body and recognize any signs of healing. The sixth reason is to manage your pain. First, stop doing the offending activity. Control your pain by trying things every day and seeing for yourself what activities soothe your pain. Then try a little bit of computer work and stop immediately before the pain begins. Take breaks, use hot and cold treatments, and do stretches throughout the day. The seventh reason is to learn exercises that help you recover from RSI. Do RSI treatment exercises every single day. Let your doctor or physical therapist know about your stretching and exercise routine. Do yoga for strengthening and stretching. Do eye exercises, neck exercises, back exercises, shoulder exercises, chest exercises. Hire a personal trainer if you need help to stay motivated, learn proper technique, or to build additional strength and flexibility. Take your time, be patient, listen to your body, and don't push too hard if you experience extreme fatigue or pain. The eighth reason to read this book is to deal with the emotions of RSI. This condition is debilitating and can have tremendous emotional impacts. RSI can make you feel utterly powerless. Sufferers may experience feelings of anger, frustration, and a loss of control. For some people, it can be difficult to find another person who's willing to be supportive and a good listener. RSI support groups and professional help like a psychiatrist or psychologist can be a source of relief. Doctors and rehabilitation specialists may not be a reliable source of emotional support. The authors state the 5 stages of dealing with RSI. The ninth reason is to recover in your career. Dealing with your bosses and managers when you have RSI can be a problem. Other people often don't know or don't care about your RSI. People can be cold and dismissive. Sometimes an employee's pay is linked to their productivity, threatening their livelihood. For many people, their career and their self-esteem are tightly linked. Loss of one's livelihood can deprive that person of their current perception of self-fulfillment and happiness. RSI is an opportunity to evaluate our values and decide to find other things in life that bring us happiness, like relationships or other achievements. The 10th reason is to learn safe ways to use the computer. Go slowly. Enthusiasm for returning to work may lead to relapse. Be careful about using a splint. Over time, a splint may cause atrophy or force you to work in a dangerous position. However, wearing a splint may help convince your boss and coworkers that your RSI is real. Just don't use it too much when typing. One common misperception in the workplace is that good ergonomic equipment and workstations completely prevent workspace injuries. Repetition, the authors say, is usually the real culprit, which is a problem with work design and not necessarily workstation design. The authors discuss ergonomics in the workplace. A good computer chair must support your body comfortably and correctly. The seat must raise and lower so that your feet can be flat on the floor. The seat should tilt forward and back so that your pelvis tilts forward. Do not type when resting your arms on anything, including wrist rests and arm rests. Be careful about buying products labeled as ergonomic. Some products live up to the standards, but many do not, and some are even dangerous. Read product reviews and consider cheaper options before spending a lot of money. Desks made for writing are typically taller than the necessary keyboard height. The monitor should be placed such that your eyes are level at the top of the screen. Don't place the monitor too high or too low. Keyboards are very problematic. The pronation position can be stressful for around 15% of the population simply due to their unique anatomy. The right hand can be especially vulnerable because it is used for both keyboard and mouse. Using shortcuts with Shift, Alt, and Control can strain the tendons and fingers. Unwary users often hold their hands in a dorsiflexed or ulnar deviated position. Some users may cause damage by putting too much force on each keystroke. The authors don't say much about the dangers of the mouse or trackball. Of the handheld mouse and trackball products that the authors tried, none were deemed safe. They suggest that more studies are needed. The 11th reason is to learn about resources that can assist you. Support groups are highly encouraged. The authors list a handful of support groups in California, Connecticut, and New York. Newsletters, government organizations, and non-governmental organizations are also listed as resources. Thank you very much for listening.